So what time's the movie?
It looks like it says about 8:30 here.
Oh, we have a couple of hours.
Yeah.
Do you want to watch TV or play a game or something?
No, actually, I have a question for you if you don't mind.
Yeah, what's up?
You're the HR person, like the HR manager at your office, right?
Yeah. Are you having some sort of employment problem?
No, nothing like
Okay,
that.
good.
Okay, we're going through open enrollment, and we have 2 health plans, and I'm trying to decide between the 2. But honestly, I can't tell the difference between them. Like,
Oh.
I just need some help deciphering.
I can totally help you with that. When I was starting doing benefits at my company, the insurance broker we have explained everything to me, and it made everything way more clear.
Okay.
Do you have your enrollment materials with you?
I do. We just got our meetings done this morning.
Oh my gosh. Okay, well, let's look. Give me a second. Okay. Alright, so you have 2 plans, obviously, and let's focus on your enrollment guide, because you also have the summary of benefits and coverage,
Yeah, I saw
your
that.
SBCs. They're really complicated, or can be if you don't know how to read them. The ACA requires insurers to give them out, but your enrollment guide breaks everything out so nicely. Your broker did a great job.
Okay.
So there's those for you. So between the 2 plans, it looks like the biggest differences are in the premiums, the deductibles, and the out-of-pocket maxes.
Yeah, I have no idea what any of those words mean.
All right, let's start with your premiums, because
Okay.
that's the cost you're going to see first.
Okay.
So your premium for your base plan is $25 a month, and the premium for your choice plan is $50 a month. It is basically making sure that you are insured. Now, when you get married and you decide to add your spouse onto it, or you guys have kids and you want to add them onto your plan, it's going to be more expensive.
All right, so a premium is basically the amount of money my employer takes out of my paycheck each month, so I have insurance.
Right. It looks like that, and is the case for your plan. Okay.
So then what's a deductible?
Okay, the deductible is the specific amount of money a health plan participant, so you must spend before the insurance company will pay a claim.
Okay.
So for the base plan, the deductible is $3,000. You would have to spend $3,000 before the insurance company pays your claim. For the choice plan, the deductible is $1,500 for in-network.
All right, so my premium for the choice plan is lower, the premium for the choice plan is higher.
Right.
But the deductible is lower, which means I could end up spending less. Right?
Yes. But also, don't forget that health insurance is a little funky. So what makes it different than, say, auto insurance is that you don't always have to meet your deductible before the insurance money kicks in.
Okay.
Yeah, I know. Also, some of what you spend doesn't apply to your deductible, like your copays or your premiums.
So then what's the difference here? It says out-of-pocket max. What's the difference between that and a deductible? Like, once I hit the deductible, didn't you just say my insurance company pays the rest?
That's why there's an out-of-pocket max. Oh, I know. The out-of-pocket max is the most money a health plan participant has to pay during the year for health services. And sometimes the year can be calendar year or plan year. Looks like yours is plan year.
Okay.
So for the base plan, your out-of-pocket is $6,000, and for the choice plan, it's $4,000. So if you hit your out-of-pocket max, then the insurance company will pay for everything after it. When you hit your out-of-pocket max, you don't have to pay for anything except premiums anymore.
Interesting.
That can kind of vary depending on your plan, but not with yours.
So for the base plan, I would be paying less per month unless I get hurt or have to go to the doctor a lot, and then I could end up spending more because the deductible and the out-of-pocket are higher.
Right.
With the choice plan, I may be spending more per month, but because the deductible and out-of-pocket max are lower, I could be spending less than the base plan.
Right.
Okay.
And so, yeah, that's usually how it works.
Okay.
Yeah. Keep in mind, though, that what you pay in deductibles and co-payments actually applies to your out-of-pocket max. Just your premiums don't.
Okay. Well, I think I'm getting this. But wait, what does it say here? Deductible then 30%?
So that 30% is your co-insurance. It's the percentage of your medical bill the insurance carrier will pay after you've met your deductible, but before you meet your out-of-pocket max. It's kind of what the portion you share of your medical bill with your insurer, right? So deductible, then 30%, means that you have to pay the full amount of your deductible, and then you're responsible for 30% of your remaining bill, at least until you hit your out-of-pocket max.
Okay, so that's where I could be paying more money even after I meet my deductible, right?
Right, but your
Okay.
co-insurance is applied to your out-of-pocket max, again.
So can I run an example by you just so I know I understand it?
Yep, go right ahead.
Okay, so I choose the base plan. Okay, I'm paying $25 a month as my premium, so I have insurance.
Right.
Okay, I'm on the plan for a few months and I haven't needed it, but then I get hurt and I have to go to the ER. All right, so my total medical bill comes up to, I don't know, like $30,000.
Okay.
All right, I have to pay the first $3,000 because that's my deductible.
Right.
And my plan requires me to pay a deductible for emergency services.
Right here.
And then the rest of the bill is split between me and the health insurance company because I pay 30% of the rest, right?
Kind of, but once you hit your out-of-pocket max, which is $6,000, the health insurer pays the rest of your bill. So you pay the $3,000 plus 30% of your remaining bill, but once you paid a total of $6,000, insurance company covers the rest.
Okay. All right. Then say I have to go back to the ER a few months later because I'm sick or whatever. I don't have to pay anything because I've already hit my deductible and my out-of-pocket max, right?
Right.
Okay.
But say you hadn't met your out-of-pocket max on your first visit. So during your second visit, you would have to pay your co-insurance amount, that 30%. And you'd have to pay that until you hit your out-of-pocket max. Some plans have differences, like you have to meet your deductible during every single ER visit, but your plan doesn't.
Okay.
So it's pretty simple. Yeah, I know this is super confusing.
Okay. It's good to know. I really have no idea like what I would actually end up paying. Like this is ridiculous.
I totally understand. But just as a reminder, there are differences between going in-network versus out-of-network. So it looks like your base plan only applies for in-network benefits. So that means insurance only pays when you go in-network. For your choice plan, the insurer does pay for some out-of-network. It's always less expensive if you go in-network, though. Yeah.
Well, which plan do you think I should choose?
Well, think about how healthy you are, how often you go to the doctor, how risk adverse you are, how much money you really want to spend.
Yeah.
I mean, so, okay, you're pretty healthy, but you have bad asthma.
Yeah.
You got that super nasty cough last year and got pneumonia. So that
really
might be something you want to consider as you're deciding what plan to take.
Okay. All right. Well, if I end up with more questions even after I get on a plan, is it okay to ask you?
Oh yeah, of course. I know the stuff inside and out though. But based on your enrollment guide, I'm pretty sure the same insurance broker we do. Yep, Cherry Creek Benefits. Now, they know so much about your plan, you can always call them at this number. And if for some reason you lose your enrollment guide or you can't find it, just ask whoever does benefits at your company.
Okay.
They should know all that information. So you can get the right information.
Awesome. Thanks.
Was that helpful?
It was.
Okay,
really.
good.